there are so many aspects of breast cancer care where disparities still exist. And so even though these services may be readily available for many populations, unfortunately, there are still populations that still don't have access, or they may have access, but they may not have the full breadth of access for some of these cares. And also providers also are struggling with being able to provide these services to their patients. They're also struggling with, how do I get my patients genetic testing who are uninsured? I have a young woman with breast cancer and they're interested in freezing their eggs. What do I do? These are topics that, depending on where you work and what kind of hospital you work in, whether it's a rural or city hospital, these are real issues that we deal with and face every day.
Yeah, I think the main takeaway is really raising awareness about these disparities that exist. I think the first step toward being able to make any actionable change is awareness. And I think that many providers may not be aware of the disparities that they're seeing, or that patients are being treated differently based on geography or based on various facets that influence their access to care. And I think if we can increase the awareness, then we can really start to formulate some real action plans. And so again, seeing that positive response to the session immediately afterwards and in the days that followed, I think there's a lot of interest in learning more about these problems and how we can work together to start overcoming some of the barriers to access to care and overcoming some of these disparities.